This does have more the feel of, I think, a TED Talk than necessarily a whole lot of data. So I think it does fit in the theme of the day. I'll be talking more about my research vision and then a little bit more about some of the details of the work I'm involved with too. So let's start with the why. And the why here is about health, supporting health, advancing health, promoting health, not healthcare. And that's important to keep your eyes on that. The how is healthcare. And as we know, healthcare is really a intersection of a whole lot of factors that go into delivering it. Science is one of lots of things. And this is the space that I do my research in. And this is the kind of themes that I'm most interested in. We know that performance varies. And when you look across geography, when you look across physicians, other providers, when you look across hospitals and health systems, demographic groups, racial and ethnic groups, performance varies. This is also an important concept for me and for others that are involved in reform in healthcare, delivery of healthcare. So let me unpack this concept a bit. Value is really the relationship between quality and cost. Quality can be all kinds of things. I've listed a few things here. Some are sort of traditional quality markers, so mortality, for example. Some of the other things here are a lot more patient-centered kinds of outcomes, like relief of suffering, functional status, and recovery of functional status, timeliness, communication. So there are different ways to measure quality. There's also cost, and cost is all the things that you would naturally think about, sort of the inputs, the work that we do, the work that our care teams do, facility expenses, tests and treatments, all that goes into cost. So really, value is sort of all the output that we get from the system and the delivery per unit of cost that we spend, the inputs that we put in to get that outcome. And so you can improve value by either maintaining quality and reducing cost, or maintaining cost but improving quality or outcomes, or a combination of both. So let's think about this in relation to our book of business. So if we're thinking about how do we improve value, you just bring it down to sort of the patient level. What value did we get for that patient? What did they derive from that ED visit and that episode of care that we delivered? Or explode that a bit to society, scale that up. What did we as a society, we as a health system derive from that visit in the ED? And even sort of larger than that, did we even deliver on that value in the ED, or could it have been done better for better quality or cheaper delivery costs in some other healthcare setting? And this is also how I think clinically when I'm working. So we know performance varies, but we also know that it's not fixed and that we can improve and we can do better. And this is the kind of work that I'm involved with. So let's talk about the what. These are the two main projects that I spend my time on. I'll spend most of my time talking about the first one, which is the Michigan Emergency Department Improvement Collaborative. It's funded by Blue Cross Blue Shield of Michigan and Blue Care Network. We're about a little over a year into this project. And then I also have a Career Development Award from ARC that started 6 months ago. So this is MEDIC. It's a network of hospitals across the state of Michigan. There are a number of people here at University of Michigan that are on this map who are clinical champions representing our site. So Ben Barsan, David Somand, Nicole Shroof. We share data. We collaborate together to learn from each other what best practices are in an effort to drive change in ways that improve our care delivery in the ED. This is also MEDIC. This is all the faculty members. You can see a number of names up here in our department, as well as the staff that support us in our coordinating center, which is actually housed here at the NCRC as well. So lots of people involved in this work, and it's a team. These are sort of the vision and values for the project. It's many of the things already described. We're about learning from each other, collaborating in an effort to improve outcomes in a way that's driven by quality data and reporting that's useful. These are the quality initiatives that we're starting on in the first year of our project. This is a project that gets annually rebudgeted and refunded. And as long as we continue to do well, we'll continue to go on. So we'll be looking at appropriate use of head CT for minor head injuries in kids and adults, use of CT scans for pulmonary embolism in adults, use of chest x-rays for pediatric respiratory illnesses in kids, and then as a sort of subset of our sites, we'll also start thinking about alternatives to hospitalization for certain disease states, also in kids and adults. And finally, I want to talk a little bit about my career development award. So similar kind of work. I'm using Medicare data, which is a common data source for health services researchers. And we're looking at what explains the variation that we see across hospitals, across physicians, in how we choose to admit patients to the hospital from the ED. It's a 5-year project, and ultimately the goal here is to get at what are the cost and outcome consequences of that variation. When we admit somebody who has sort of a marginal reason to be in the hospital, do they do better or worse than those that might go home? Here's my only data slide. This is work that I and Amber Sabatini, I don't know if you remember her, she was here 2 years ago as a research fellow, did. It provides some of the foundation for the Career Development Award. This is just displaying the range of variation across very common conditions that we admit frequently to the hospital using a large national data set. And you can see that there are lots of disease states that we commonly admit where there is quite a bit of variation in who we choose to admit. And that's the kind of work that I'm going to be studying with the Career Development Award. So I'm done. Whirlwind tour of my research vision and agenda, but if anybody has any questions, I'm happy to talk about it. And I will say too, if any of these themes are at all interesting or pique your curiosity, please come find me and we can talk about it. As to why performance varies?
Yeah, and how you change it.
So it's certainly there are complex factors as to why we see differences in outcomes and in care delivery when we look across various areas or regions. There is a lot of work in sort of understanding the kind of institutional and cultural factors that influence some of that. You know, with the kind of data that I have, I'm not really in that kind of space. And I think it requires a lot of qualitative work to really get into people's heads around why there may be some of those differences and factors that influence that. But it's important work, and there are people doing that. Yeah. Hey, Dr. Newmar.
Interventions that might change practice. I mean, Sally talked about it a little bit, but you probably have some ideas of what kind of interventions you have envisioned moving forward once you identify some of the deficiencies.
Sure. So the question was around potential interventions as a result of the data that we're deriving, particularly in medic. I think there are lots of ways that change can occur. I think fundamentally some change will occur simply from the audit and reporting that comes back to physicians and what we're hoping to be as close to real time from those cases. I think there is also change that occurs when at the group level, so at sort of the physician group or the site level, you understand your performance relative to your peer groups. There's also change that comes there. But I think a lot of also change will just be us, you know, as a network understanding why there is an outlier, either a worse performer or an outlier better performer. What is the difference there? What are they doing differently that we can understand and disseminate across the network? So some of that work will be future that I can't predict necessarily, but collaborative. Thank you.